viewers, you are welcome to another tutorial with James. On our previous video, we spoke about the female gynecoid pelvis, which we established that it was an ideal pelvis for childbearing, and that kind of pelvis was peculiar to midwives. But today, we want to make a little extension and discuss more on the pelvis. The pelvis is a bony organ. It's located between the abdomen and the legs, or we can say it's located at the lower back. It has 4 bones that are fused together. We have the 2 innominate bones, we have the sacrum and the coccyx. The innominate bone has 3 parts. We have the ilium, the ischium, and the pubis, or we can say the pubic bone. The ilium is the flared out part of the innominate bone. Anteriorly, it is smooth and concave for the attachment of organs. Posteriorly, it is rough and convex for the attachment of muscles and ligaments. The upper border of the ilium is called the iliac crest. When you rest your hand on your wrist, it means that you are resting on the iliac crest. The iliac crest has a bony projection, and it's known as the anterior superior iliac spine. Now, 2.5 centimeters below is another bony projection known as the anterior inferior iliac spine. Similarly, there is another projection behind the ilium known as the posterior superior iliac spine, and below is the posterior inferior iliac spine. Please, if you have followed to this extent, you can type following or followed. Next, we'll be discussing on the ischium. The ischium is the thick lower part of the innominate bone. So when you sit, anytime you sit, you are sitting on the ischial tuberosity. So this ischium, which is the thick lower part, is also known as the ischial tuberosity. A little above and behind, as you can see, are ischial spines, and these ischial spines help us to estimate the stations of the fetal presenting part, especially the head, during delivery. Next, we'll be discussing on the pubis or the pubic bone. The pubic bone is the anterior part of the pelvis. It has 3 parts. We have the superior ramus, we have the body, and the inferior ramus. And the inferior ramus have formed an arc to be joined with the ischium. As you can see, there is a padding in between the pubic bone, and that part is known as the symphysis pubis. There is a hole enclosed on the body of the pubic bone, the ramus, and the ischium. This hole is called the obturator, and it allows nerves and blood vessels to pass through. There is also a deep cup located on the body of the innominate bone. It's called the acetabulum. This acetabulum receives the head of the femur. Next, we'll be discussing on the sacrum. The sacrum is a wedge-shaped organ. It has 5 bones that are fused together. Superiorly, we have the sacral promontory. Anteriorly are the hollow of the sacrum. Laterally are the wings or alae of the sacrum. The sacrum also have 5 holes or foraminas that allow the nerves and blood vessels to be supplied to the caudal inguinal. Next is the coccyx. The coccyx is a vestigial tail. It has 4 bones that are fused together. It tilts backward, has the ability to tilt backward during delivery. Without this coccyx tilting backward during delivery, a woman cannot give birth. The fetal presenting part cannot be delivered. And when it tilts backward, it's called the give of the pelvis. We will be discussing on the joints of the pelvis. The pelvis has 4 joints. 2 sacroiliac joints at the junction between the sacrum and the ilium. We have 1 sacrococcygeal joint, the junction between the sacrum and the coccyx, and the symphysis pubis, one symphysis pubis. Also have ligaments. The ligaments are sacroiliac ligaments. We have the sacrococcygeal ligaments. We have the interpubic ligaments between the two pubics. We have the sacrospinous ligaments between the sacrum and the spine. We have the sacrotuberous ligaments. With this, we have extended how the pelvis look like. And like I said, please share, comment, subscribe, like, and keep following. Thank you. See you next time.